I'm taking.
This meeting is being recorded.
Great, nice to meet you, Zoe.
Good afternoon, everyone.
Hi, Betsy. Marianne, I think we might be hearing something coming from you. Could you put yourself on mute?
Put myself on mute.
I think that was Big Ben.
Yeah, there's 13 clocks in this house. They all chime.
We'll just wait a few more minutes here for Kathy. And then we'll get started.
Everything okay?
No.
What do you want me to, can I help you? All right, let you get up.
Okay, it looks like Kathy is in.
Hello, my friends. I am calling the Mental Health Board meeting of April 19th, 2022 to order. I'm going to read the standard announcements and then we will proceed to the meeting. The Sonoma County Mental Health Board is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health care system. We support reducing stigma for individuals needing all levels of mental health care in all communities in the county. We support treating each person with compassion and respect, regardless of gender, sexual identity, and cultural or ethnic background, and acknowledging the influence of individual lived experiences. We support working with the local mental health system to eliminate racism from our minds and hearts, and ensuring that our policies are equitable and benefit underrepresented communities. We support acknowledging that environmental factors can increase mental distress and support efforts to reduce such stressors. We support providing support to the families of those with mental health challenges. The Sonoma County Mental Health Board collaborates with the Behavioral Health Division of the Sonoma County Department of Health Services to increase public and professional awareness of individuals with mental health challenges. We strive to influence positively the mental health system by listening to public input and working with behavioral health services to create policies that will offer hope to individuals living with mental illness and to their families. So I am going to do a roll call. Annabelle Nygaard,
Kathy, this is Betsy. I'm here.
okay, Betsy. Bob Cobb,
Here.
Carol West. Carol is excused, she is on vacation. Kathy Smith, I'm here. Mary Ann Swanson. Michael Johnson,
I believe Mary Ann is here.
okay.
Yeah, I see her twice.
You've seen her? Okay. Michael Reynolds,
Yes, I'm here.
okay, and did, when I called Michael Johnson, I was thinking about Mary Ann. Is Michael Johnson here? No. Okay, Missy Jackson,
Here.
hi Missy, would you like to introduce yourself? This is our newest member.
Hi, everybody. I really appreciate this opportunity. My name is Michelle Jackson legally, but I go by Missy, and I'm a school social worker with Sonoma Valley Unified. And Marianne is my former, I don't know why I can't get the word out, field supervisor. So it'll be nice to see her on the other side when she shows up.
Say something.
Okay, welcome.
Say something.
Something.
Well, you're live. Say
Okay.
hello.
Hello, I think I'm in. This is Mary Ann.
Yay, Mary Ann.
It is not on mute.
Missy Jackson just introduced
She gave
herself.
you a thumbs up.
Okay.
and
So
said
now
that
what we
you were
need
her former supervisor.
is video.
Peter McElweeny,
Present.
Peterson Pierre. Vanessa Nava. Okay, and we have District 2, we have 2 vacancies. No, District 2, we have a vacancy. District 4, we have a vacancy. And District 5, we have 2 vacancies. So are all of is everybody let's see, we have a couple of more people who are showing up as attendees, but Connie Peteritt is going to be, she's attending the meeting today. Would you like to say hi, Connie, so that we can see who you are?
Sure.
And
I
we
was
could
having trouble with my computer, so I'm on my phone now. It kept
Okay.
dropping me off on the computer. So my name is Connie Peteritt, and I teach second grade in Healdsburg, and I am a parent of a consumer of services.
And a prospective
county.
board member.
Yes,
So I wanted everybody to get that introduction.
thank you.
Okay, and what district were you in?
District 4.
District 4. So that way, I'm going to pencil you in
Thank you.
as a prospective member in District 4. So that will give us just a few vacancies then. Okay, it's nice to meet you.
Nice to meet everyone.
Uh-huh. Okay, so our approval of the March 15th minutes will be postponed until the May meeting because Pilar had a little bit of trouble getting them out to us. So everybody take a look at those and we will vote for them on the May meeting. Did we have any consumer affairs report? I don't know if anybody has taken that over from Kate yet. So
I'm sorry, Kathy. My understanding was that you were going to reach out to Sean Boland and Sean Kelson to see
yes,
if one of them wanted.
and I forgot to do that. So
Okay, yeah, that's fine. I
Thank
just wanted
you.
to make sure that, yeah, want to make sure we're on the same page. Thank you.
Yeah, it
But
does
they-
look,
Sean has his hand up.
yeah.
He's
Oh,
here.
Sean, yes.
Right. Yeah, hi. Yeah, I had anticipated chiming in. Yeah, I just want to let folks know about some new services and events coming up at Interlink Self-Help Center and the Wellness and Advocacy Center. Folks have, some people on the board and others have heard about and worked on the Making a Plan program, the advanced care planning tools that we created with mental health in mind. We've been working on this over the years with Susan Keller, and Kate and I helped from the beginning, and Michael Reynolds and Carol West and all kinds of other people, Erica and different people across the state helped with creating these. And we just completed a Making a Plan facilitator training program, and there will be peer providers at Interlink and Wellness and Advocacy Center that can support people to work through creating an advanced care plan with mental health in mind. That is going to be the topic of our forum this month on Friday, April 29th from 1:30 to 2:30 at Interlink. And that's open to the adult general public. And then there'll be a special presentation on Thursday, April 21st during the Successful Living group at the Wellness and Advocacy Center. We're excited about the opportunity this will provide, and the quality of these tools. Is really encourage folks to check them out, and they can go online and look at them as well. Let me know if you want more direction towards that. Thank you.
That is great news. And I know you have been working on that hard for a while. Okay, any questions for Sean? If anybody does see a hand go up, let me know, because I can't see all of them.
It's Mary Frances with Sean. I have a question for Sean. If we were to be connected with families who, which is our major audience, who have a loved one who might be interested in doing an advanced care planning, I mean, are you open to referring, they're being referred to Interlink, or are you anticipating being overwhelmed with your own needs for assistance with planning?
I encourage anybody who would like to become a member of Interlink and check this out to do it. I don't anticipate being overwhelmed with this.
Okay.
We'll find out.
Thank you.
Sometimes overwhelming is good. Better than nobody showing up, right?
Yes.
Yeah.
Yeah. And we have also on the mental health month calendar, we've got numerous events going on at the centers. We're going to have a main open house at the Wellness and Advocacy Center on May 5th. That's going to be highlighting all of the peer programs. And then we'll also be having, and they're going to be showing, I forgot which movie, a movie with a facilitated discussion after that. And then at the Russian River Empowerment Center, at Interlink Self-Help Center, and at the Petaluma Peer Recovery Center will have their own individual open houses, and we'll be screening Crooked Beauty and Crazy Wise at Interlink and PPRC, and doing some other fun stuff. We're going to make some big cards and for some facilities with members for, you know, Mental Health Month, and just saying hi and checking in with folks that are in certain facilities.
Okay.
So that's it. Thanks.
Thank you. Okay. Are there any public comments? Erica says, thank you, Sean. That sounds great. Okay. So this month's special presentation is North County. So Bob Cobb and Peter McEweeny, if one of you would like to facilitate that. I know you've invited people.
Peter, would you, I have one comment to make, but would you introduce the people who you've arranged to present? And yeah, that was, I see Kim Bender asked about screen sharing. If you have need for that at the beginning of your presentation, would you just indicate that request, and Pilar will provide that option for you. Thanks. And Peter?
Yes.
Yes. So I'm going to be introducing Kim Bender, who is the Executive Director of the Healthcare Foundation, Northern Sonoma County. The Healthcare Foundation's been around for over 20 years, and Kim Bender is our Executive Director, who's been with the foundation for a little bit over 2 years now. And she's going to be presenting a short description of the work that the foundation does in the area of mental health services. So Kim, we're very happy to have you here.
Thank you. Thanks so much. It's nice to see so many friends here. What I'd like to do is share with you a little bit of how we got to where we are, and then show you what we're doing. We went through, when I arrived 2 years ago, we were at the end of a strategic plan cycle, a 5-year cycle, and we launched a new one. As you might imagine, it took longer than we had thought because of the pandemic. We weren't able to meet in person, and but we did do some, it gave us the opportunity to really take in a lot of the racial strife that was happening in the country. We began to look at racism as a public health crisis. We looked at how to do our grant making with social equity lens. And we were recognizing more and more the community cultural wealth that exists in our community. We did a number of listening sessions, both attending other listening sessions, comités, and held our own listening sessions, inviting our grantees and other community-based organizations to come and talk to us about what they were seeing out in the community. And we also asked, we brought together clients and people who were served by those organizations, and we brought in a number of community health workers and promotores into that group to listen and see what was really happening in the areas, the 2 areas that we were identifying as our primary focus, which are health access to healthcare, and mental health. We also engaged a local epidemiologist and friend of the Healthcare Foundation in the county, Sarah Marcos, an epidemiologist who's done a lot of work here, to assist us in looking at the data. And we did an extensive literature search that I just want to share with you the findings from that around mental health, because it was really interesting to us and surprising. I'm going to go ahead and share my screen. Yeah, just a few slides and then to where we landed as a result. Okay, so we were looking at how can we improve mental health, and we were also really interested in, can you guys see my screen now? We were really interested in moving upstream a bit, and we had to define what that meant for ourselves, and that meant moving towards away from interventions that addressed people who were already suffering, but moving upstream to where we could potentially make interventions that would improve health before people were already in need of clinical interventions. So the data that we looked at, numbers of studies that were out there, and we looked at community interventions and learned that interventions that involve multi-sector partnerships, including community members, for example, community health workers as part of the intervention, and or involved delivery of services in community settings were really very effective. Some of the assumptions that were that brought forth were that the communities already have knowledge, and this is no surprise to any of us here, I'm sure, but that community mental health and community social environments are super important, and that we should target as many socio-ecological levels as we could. We wanted to address interventions that, again, were more upstream, and sort of on the right side, we see we're upstream at the top and downstream at the bottom, and try to get at, we are not a policy advocacy organization. We're also a very small regional organization, but we wanted to find a way that we could make a difference in community mental health upstream. And this is sort of another way of looking at it, and it's sort of zeroed in on living conditions, physical environment, building, at the bottom of this slide, building community capacity, community organizing and civic engagement, and strategic partnerships were important. So when we came to the strategies, it was consistent across the literature that building social capital was a great way to improve community mental health across the board, raising the voices of people who are generally marginalized, whose voices aren't asked or raised or heard in community settings and planning processes around physical spaces, around the needs of the community. So this became sort of a focus for us, is how can we increase social capital in underserved communities? Low social capital is associated with a high risk for depression and suicide, as I'm sure all of you know. And increasing social capital acts as a mediating factor for stressors of all kinds. So we looked at what are the actual strategies that we as a small foundation could consider. So we looked at community groups, we looked at strategies that had measurable success in other places, including community gardening, community service, but where did that leave the Healthcare Foundation? We looked at other ways to build social capital through peer support. These were all strategies that came up in the literature as having measurable success. So we then went, I'm going to switch screens. Tell me if you can still see my screen. Can you still see it? Yep. So this is now on our website, and it's just a place that collects where we landed after doing all that research. Again, the mission of the Healthcare Foundation is to eliminate health inequities in Northern Sonoma County. That's our vision. And our mission is to connect people and resources to promote wellness in underserved communities. Our guiding principles are community, compassion, and equity. So where we landed, taking all that knowledge in about what we could do in the area of mental health, we had a program in existence for the last 5 years called the Mental Health Talent Pipeline Project, which looking at the data, like, this is something we need to double down on. We need to invest in addressing the shortage of bilingual, bicultural mental health professionals in Sonoma County, and particularly in North Sonoma County. So we provide now full tuition scholarships to students studying mental health professions that intend to live and work in Northern Sonoma County, or we broaden that to sort of Santa Rosa North. We also invested in and saw the value of community health works and promotores, and received and distributed grant money to 12 different organizations that were out in the community doing vaccine outreach and education and other health outreach. We also invest in the HOPE program at Santa Rosa Junior College for first generation and disabled students in medical careers. The program that I also want to talk to you about that pertains to really investing upstream in community wellness is a new initiative that we've been working on since we began the strategic plan to convene and invite community voices in around a visioning process for community wellness centers. And we've started this process in Cloverdale, with money we received recently from the North Sonoma County Healthcare District to have a 2-year process inviting community members into a conversation to do an actual visioning. I've seen too often, and I saw here in Sonoma County, times when a city official will present a plan for a park, for example, and ask for feedback from the Latinx community and say, you know, here's the plan. We value your feedback. What the truth is, the plan is already done. The park is done, and the feedback that I heard from people was, where is this park? But this is not a place that we would send our children. We don't know how to get there. It's up in the hills near Montage, or it's somewhere inaccessible. It has the wrong kind of play fields. And where's the community center? That's an example of the kinds of things that people were saying at a presentation I attended. So we are now funding and convening with facilitation from On the Margins, a local consulting group that does work in Sonoma County around equity. A 2-year process in Cloverdale with stipends for participants who work full-time at other jobs to come attend these focus groups and convenings. And the visioning is already beginning. We will work in tandem with the, and a partner in this endeavor is the health center, excuse me, I'm blanking on the Alexander Valley Healthcare group that has a sort of parallel process for a physical space that they're designing, a health center. But that health center will not be able to house all the things that the community really wants. So we're inviting and partnering with La Familia Sana and Nuestra Comunidad to host these convenings, to do outreach to farm workers and other people in the community, including all socioeconomic groups, to listen to and help vision together what people want. And things will include so far a place for teens, place for people to sort of a ball field, barbecues, alternative medicines opportunities. So those are the kinds of things. We don't know where it's going to land. We're just beginning this process, but we know from looking at the data that the result of this kind of invitation to brainstorm and vision their own space creates a feeling of trust and belonging. It reduces anxiety and stress, increases safety, and it actually has an impact on a lifespan. So we know from a similar project down in Richmond, California called Pogo Park that was studied over the course of 10 years that the census tract where this process was engaged in with community members had the highest increase in lifespan of any census tract in California over that same 10-year period. So we're excited about this project. We want to bring it another visioning process to Healdsburg and Windsor. That's sort of the Healthcare Foundation's area from Windsor North. And we invite anyone who's in that area to participate. And we hope that the whole county will engage in similar processes to lift the voices of community members to improve community mental health. So that's my presentation. Open to questions. Let me unshare, there we go.
Kim, this is Peter. I wonder if you could talk a little bit more about the mental health talent pipeline. How many students have gone through the program? How many are currently in the program? What we're hoping to achieve in the next few years?
Sure. We launched the pilot in 2018 prior to my time. And at that time, we had students who were in different points of their educational career, and some were just beginning, some were already in their program, some were in their traineeships. But currently 15 students are in the program. Some have finished, some are just beginning, they're in their first year. And the program started out with a slightly different concept of giving partial scholarships and then stipends for traineeship year and a signing bonus when people signed on to work at jobs in Northern Sonoma County, and then a 2-year retention bonus. What we learned from the pilot was that there weren't really enough traineeships and jobs in our area, so we weren't able to follow through on that. So we ended up giving people signing bonuses to work elsewhere in Sonoma County, which is also very important. But we shifted the program after listening to students after the pilot years, and decided that what was most important to people was to come out of their educational experience with less debt. And so we worked with donors to and worked with USF Santa Rosa, the primary program with whom we work, and were able to secure full tuition scholarships. And it had a massive impact on the interest in the program among the bilingual, bicultural students that we are targeting. We went from having kind of recruit students and invite them to get a $5,000 per year scholarship to having 24, 25 applicants for the 4 slots that we have for these full tuition scholarships. And we are looking at trying to commit to the program for the next 10 years. We're working with a donor who we believe we'll know in the next couple months. We're working closely with USF Santa Rosa. It's a wonderful program designed for working adults. It's a cohort 1 day a week program that's very friendly to people who work and have children, which is the typical profile of the bilingual students that we're recruiting. We were recruiting from here so that we know that people will likely end up working here. And the full tuition has been a life changer because tuition is between $80,000 and $100,000. So we're trying to fully fund tuition for 4 students.
Looks like Michael has a question.
Sure.
Thank you so much, Kim. It sounds awesome. Sounds like you're doing some fantastic work. Thank you for sharing that with us. I really appreciate the inclusion aspect in the planning. I'm wondering if there's also any intention as the projects get going to include diversity and in the hiring of who actually does the work, including local businesses and also and minority businesses as well.
Such a great question. Yes, that is the model. We're really looking towards our friends at Pogo Park in Richmond who hired from the community, trained people to learn the skills necessary to actually build the project, and the sense of ownership and the pride and the sort of the social capital that investment made was it's so inspiring. I encourage anyone to go down to Pogo Park and take a tour to learn and see the transformation of this blighted community in the Iron Triangle that is now vibrant, and where children are coming to the park that had been sitting empty and blighted for decades. Now they've expanded and are doing a whole bigger park system. They're building and designing a community center, a community wellness center. They've just got a $5 million grant to connect different services from Kaiser to the park to the school through a yellow brick road with proper lighting, very friendly lighting. So yes, that model is really something we're looking to. And I think there's also a project in Sonoma Valley that On the Margins has been working on. They're in the design phases now. So yes, absolutely want to hire local and hire the people who are designing it and build their skill set to actually take full ownership of the end product. So thanks for bringing that up. I didn't mention also the other learning from our pilot project around not having enough traineeships. We now are also, in addition to funding the scholarships, we're funding traineeships in Northern Sonoma County. We have 2 that are happening now. I saw Becky here today, one in Cloverdale, one in Healdsburg. And we just got word today that we're going to be able to continue those traineeships again for another set of students next year. It's hard to insist that people do traineeships in our area if we don't have any traineeships. So we need to fund them. These bilingual students actually are quite in high demand and have many options when they graduate from their programs. And so if we're going to retain them, we need to pay them during that intensive year when they're getting their training hours. So we are funding those as well.
That sounds amazing. Any other questions for Kim?
Yeah.
I have one. You invited residents in various communities in North County to, if they had interest, to become engaged in some of the mental health efforts. How would how would they approach that?
Let's be in touch. I'm just about to, we got funding for the Cloverdale project. So if you live in Cloverdale, we will be advertising and outreach will be happening. You'll see and hear about that in the coming months. I would say probably we're working on the planning right now, and you'll probably hear more about that in July. In the meantime, I'm seeking funding for similar processes to be again facilitated by On the Margins in Healdsburg and in Windsor. And so that's standby. You will hear more about that, and we'll do our best. And we also sign up for our newsletter because we kind of advertise to our large email list about what we're doing, but I'm sure we'll do our best to do outreach so that anyone who's interested can participate. So I'm look forward to that and hope that you'll stay in touch.
Thank you.
I'm going to mention that there is a comment from Elizabeth Vermillier to everyone. CPI is very interested in workforce development and providing a pipeline for experience and work in the county. We're very interested in creative problem solving here. So that's something to keep in mind. And Erica commented that she loves the long-term planning and program that has a 10-year plan. It's fantastic. So
thanks. I know it's a big leap. We're in the formulation, and I got some great news this week that it looks pretty promising that we're going to have funding for that for a 10-year span. So
excellent.
Yay. Thanks, Erica.
Okay, any other questions?
No, I have just a comment. This is Betsy for Kim. Kim, we are no strangers to Doctora Daniela Dominguez, who we've worked with for some time now. And just I've learned and known to really value her work and the intentionality behind her work. And so in those that are part of her team. So I really appreciate that she's part of this, especially as you're looking at the long-term vision and also listening and being receptive to what is being said with some follow-up with those that are being part of the process. I think that is sometimes missed, and I really appreciate that from the work that she does with her team. And so any support that this group can have, like Bob mentioned, I think we really appreciate just being in the loop and being able to spread the word. I think that's important.
Thank you. And just for anyone who doesn't know, Daniela Dominguez is the lead On the Margins, and she herself is doing the Cloverdale convenings, and so I have so much to learn from her. She's amazing. She also is the program director for the USF Santa Rosa marriage and family therapy program, that the cohort model that's got such a strong equity component. So she's also involved in that program, in the mental health talent pipeline, and helping recruit students from North Sonoma County into the program. So we're really grateful for her support in that way too. So thanks for bringing her up.
Thank you, Becky. Okay, thank you very much, Kim. It was a very interesting presentation.
Thank you so much. And I encourage you, we're about to reboot our website in a couple months, but the information and the programs are under the Who We Are section of our website if you're interested in learning more about the programs and the grantees. So thank you so much.
Thank you.
Mhm.
So Bob and Peter, did you have anybody else that you wanted to have present?
Yes, we have several who are here from various agencies that provide mental health services in many forms in North County. I wonder if I could call on and introduce Lupe Navarro, who's the Executive Director of Latino Service Providers. I believe she's available to present, hopefully.
Yes, I am here, and thank you again for the invitation. I love that we're a great segue to Kim Bender's presentation as we're talking about workforce. And please bear with me. I hope my internet isn't spotty as I'm speaking, but if it is, I'll make sure to go ahead and turn my camera off. With that said, I would also like to invite Sara Isabel Virgen to join me in introducing herself first, and then we'll go ahead and get started.
Good afternoon or evening, everyone. My name is Sara Isabel Virgen, or Sara for short, and I am the operations manager here at Latino Service Providers. So with that, we're actually move forward. So the mission of Latino Service Providers, or LSP, is to serve as a bridge across generations in the Latinx community. We do this by advancing the development of young leaders, building awareness about health and wellness, culture, social issues, and advocating for equity. And here is our fabulous, we like to call them dream team, small and mighty team, but this is who LSP is. And then this is some data that was collected. Thank you to the Youth Truth Survey of Sonoma County. We found that 70% of our students experience depression, stress, or anxiety, and an obstacle to learning. 43% felt prolonged sadness or hopelessness in the past 12 months, and 32% have an adult from school they can talk to when stressed or upset. So this is what LSP, or what we do. We incorporate community outreach, our weekly newsletter, and monthly meetings. Through community outreach, we share resources with our community. Right now, currently, we are doing a lot of pop-up events. So this is where we go out in the community. We invite our youth promotores as well to kind of share on the resources and services that are currently being provided within Sonoma County, especially within mental health services. You know that, and we understand that that's very much a need right now. Same with our weekly newsletter. It is bilingual and bicultural. It goes out every Monday morning at 8 a.m. Again, it includes amazing information, current information that is focused around supporting or advertising, advertising events that are currently in Sonoma County, also resources, services, etc. There's no fee to join, but again, we want to also push that it is bilingual and bicultural. And lastly, we have our monthly meetings, which happened every third Thursday of the month. And this is where we invite a different local organization that specifically works, that provides mental health and mental health services. We've worked with various different organizations, for example, NAMI, Humanidad, etc., where they come in and talk about their current resources and services. Right now, all of those monthly meetings are happening online. We used to have them in person, but because of COVID, we decided to go virtual. We also provide these events with real-time translation support. So if anyone needs that English to Spanish, we provide that as well. And then Stomp the Stigma is one of our bigger events that happens during May. It is an MHSA funded event. Our goal is to for local mental health organizations to work collectively to create an annual event in recognition of Mental Health Awareness Month. It is an opportunity for the community to come and join us for the day and practice self-care with various activities. And again, promoting mental health services. We do this in partnership with local college or university where we promote mental health services and practicing self-care. It is a primarily youth-led collaboration or youth-led event in collaboration with other organizations such as Humanidad, LGBTQ Connections, Peers, Sonoma County Indian Health Project, etc. And we're excited to have this event happen again in person this year. The last 2 years, unfortunately, we weren't able to do that just because of COVID, but this year we're bringing it back, and it's going to be on May 13th at the SRJC from 5 to 7 p.m. It is a free event open to the public.
Thank you, Sarah Isabel, for the overview of LSP. I do like to share that for LSP, in our staff, 2 of my staff are former youth promotores of our program. And then also, if you're interested in receiving LSP's newsletter, please visit our links or visit our website, enroll as a member, and you'll receive the newsletter. In addition, if you like our social media platforms, you can also be informed and receive information of what's upcoming. Our youth promotores and staff are really good about sharing any upcoming events, or as Sarah said, of any information or resources. Now, the highlight of Latino Service Providers is our Youth Promotor program. It's a Youth Promotor is an innovative out-of-school time program designed to engage and train youth to lead conversations, pláticas in Spanish about mental health in their respective communities, developing them in confidence and experience, career readiness and workforce skills, mental health knowledge, and cultural connectedness. Next slide, please. The Youth Promotor program is primarily funded by Sonoma County's Mental Health Services Act Prevention Early Intervention Funds, California Department of Public Health, Office of Health Equity, California Reducing Disparities Project, Community Mental Health Equity Project, as well as Kaiser Permanente. This is a 3-year now opportunity. It's a tiered program that provides youth to apply to 3 different levels of the program. It also includes different tracks, tracks that we consider to be areas that impact our mental health, and particularly around the Latinx community. We have for cohort number 6, LSP is now, will just finish the recruitment and selection of our 6th cohort, which will include 24 promotores that will focus on salud mental, that's mental health awareness. 50% of our salud mental students are funded by Sonoma County's MHSA funds. We have 5 promotores de vivienda, in vivienda meaning housing issues and conversations, in partnership with the city of Santa Rosa and funded by Kaiser Permanente, including a partnership with Gen H. We have 5 promotores preparados, and that is focused on emergency preparedness, and 10 promotores verdes, and that's the focus of environmental and climate education. One thing that I do like to acknowledge is that this is a paid internship. The idea of the youth promotor, I will give you an example. If, for example, a promotor that applies to our promotores verdes as a youth promotor is learning how to talk about climate change and how to engage community about, for example, this year, our promotores verdes led a wonderful conversation on the water drought. Last week, actually, at Pepperwood Preserve on Latino leaders on climate change. And so our promotores were one of our presenters. Our youth promotores can then apply for a 2nd year paid internship in which they're now leads, overseeing a small cohort of youth promotores managing projects while also learning project management, program evaluation, as well as leading a research study on community needs. Then that same promotor verde can then apply for now a third year as pro promotor, where they now have an opportunity to be placed with a partner agency or an organization. In this case, this year we have our promotores verdes working on the Foothill project with Sonoma County Regional Parks and the redesign, redevelopment of the Foothill Park. Next year, we have Sonoma Water as a possible partner that would then take promotores preparados as paid interns with partner agencies. And so that's the idea of the promotores, pro promotores. Next slide, please. In case you're wondering, well, where do these students, amazing students, come from? Well, all of these students are actually from Sonoma County. And this data that we have here is really an overview of the past 4 cohorts. Does not include data from our 5th cohort, which was from our 5-year, now going on 6-year. Our 5th year has been our largest track. But our students come from Santa Rosa, Bernard Park, Petaluma, Windsor, and other small neighborhood towns, such as Sonoma. We also have Marin and also Vallejo. So with the pandemic, we had the opportunity to kind of venture out a little bit outside of Sonoma County and include students within Marin and Solano, since most of the trainings for our youth promotores were held virtually. Next slide, please. So our students are coming from 21 different high schools and 4 colleges. We have students from Santa Rosa Junior College, Sonoma State University, UC Berkeley, and UC Riverside. The age range of our youth promotores is 16 to 25. Next slide, please. One thing that I'd like to share about a program, and I know I don't have a lot of time, so I'm definitely summarizing a lot of our information and condensing what is typically our 30-minute presentation into 10 minutes. But our program, our youth promoter program, is been heavily evaluated with the intention to allow data to tell a story and definitely share our story of our promotores. We have a mixed methods design with a pre and post survey that our promotores take while entering the program and exiting the program, in addition to an exit interview, which we collect a lot of data from our youth promotores. And these are some of the things that stand out. Again, I've only selected one out of other categories that we are overseeing. But 63% of our participants learned a lot from the YP presentations. We host monthly meetings with different guiding topics. YP attend an average of 80 community events per year. So events that your organizations hold are events that we invite our promotores to participate and attend. 46% of our YP report referring others, friends and family, to mental health services. So this is where we're very proud to say that our promotores that are joining our programs, it's because they want to learn how to help a friend or family member. And 48% of our YP said that their key takeaway was how to engage in empathetic conversations about mental health. Next slide, please. And I leave you with this quote. I'll read it in Spanish, as this was quoted in Spanish, and below you'll notice that it's in English for you to follow. So yo siempre he querido aprender cómo cambiar el estigma y estos tips son muy buenos aparte. Mi hija me ha ayudado a entender que tengo que escuchar si quiero ser parte del cambio. So again, this is a participant from our community that attended one of our youth promotor pláticas that I think is important for us to acknowledge how impactful this program has been, not just for our students, but those whom they touch and connect with when leading conversations and presentations. This has been a very busy week for us at LSP, considering that we're finally back and available to host events in person. Like I shared, we had our promotores verdes at Pepperwood Preserve leading a conversation on the water drought after conducting interviews of local organizations. And then we also had a presentation this Saturday at Sonoma State University's Latino Family Education Summit, guiding conversations on how can parents be supportive with their children as they transition from high school to college, and of course, touching on mental health. So I leave you with that, and I'm open to questions.
This is Betsy. I just have a comment, not necessarily a question. I just have to say I'm such a fan, as you know. I think this program touches on so many needs of our community. I always wish that your program could be in many more places because it's so needed. And so I always hope that we can, my baby's in the background, but that we can be more intentional about funding programs like yours, Lupe. I think that we definitely need so much more of it. And just to highlight one of your students, Mar Rivas, who is an exceptional one, who got accepted to UC Berkeley, but was just the speaker or the moderator at the Hannah Institute Summit with Resma Manikan and Ibram X Kendi. Sí, mi amor, ahorita. That was really great. And she also did, ahorita te doy este aquí, mira. She also helped with the superintendent forum at SCO. So she's not only leading the promotores and doing the great work with you, but you're also training students to go above and beyond and lead other efforts such as this. And that's just amazing to me. I'd love for more students to be part of such a program. And so I'm a fan and really appreciate all the work that you all do.
Thank you, Betsy. I appreciate your comment. I completely agree. I wish we can, continue to secure funds that can help support this program. The Pro Promotor tier this year I received a one-year grant to launch really and pilot the Pro Promotor tier, which is that third tier that allows us now to place our promotores into partner agencies. And so this year, our partners were Sonoma County Regional Parks. We had Verity, we had the City of Santa Rosa, and we had Santa Rosa Community Health Center. And so it's my hope that if LSP receives the ARPA funds, we will continue the Pro Promotor tier. And I know that we have over 9 organizations interested in taking our youth promotores as paid interns. So as we're talking about workforce development, this is exactly what we need. Programs that will introduce our youth as an intern, right? While we're still guiding and mentoring them, they have the opportunity to implement the skills that they've learned here at Latino Service Providers as a youth promotor and as a youth promotor leader with a partner agency that aligns with their track or subject matter that they've trained on. Thank you.
Looks like Michael Reynolds has a question.
Yeah, thank you so much for the presentation. Clearly, again, doing fantastic work. The agency with whom I work were able to come and do a presentation for the promotores. Stephanie and Magali arranged that for us. And I just want to say, going in, I didn't know what to expect, but I was incredibly encouraged and inspired by the level of engagement and their interest in continued education and work opportunities, how to get connected to internships, paid employment, and things of that. So my question really is, what is your secret for that program? Is it recruitment? Is it training? What are you doing that's able to?
I can't give you my secret, Michael.
Come on, just whisper it. Nobody else will do it.
Right. I wish I could say what is the secret ingredient. I will say, I am one thing, as executive director and after working with youth for so many, with youth in so many different programs for a number of years, 15 plus years in education, just different spectrums, retention is always a challenge. And I've heard that throughout Sonoma County, how challenging it is to retain students. I think one thing that maybe that we've done is we've definitely built relationships, and I can share with you our report that allows students to feel like they're a part of this program. So we have had over 90% retention on almost every cohort that we've had. And like I said, this 5th and 6th cohort are our largest cohorts. We graduated 64 students for cohort 5, and we, again, just depending upon if we're able to have the ARPA grant and have the pro promotor tier, we will have at least in that tier, it's my goal to have 19 students in that tier. At least that's the budget that I'm requesting for to include, because again, every tier is a paid opportunity for our youth. So also acknowledging that we're valuing their time. We value their time in training, which for us in the real world, it transfers to professional development. So teaching them right of what the experience would be like when they pursue workforce. And acknowledging also their projects, any work that they do, any presentation that they do, they're compensated for their time. So it is that they receive a quarterly stipend for their time. And then having a team that works with them directly with our youth. I have an amazing, like Sara said, we are a dynamic and mighty team. Having a bilingual, bicultural staff that understand my youth, that know how to support our youth, because we've had the experiences and similar challenges. So we know how to be there. We know when to take a step back and allow them to lead. And we see them as the leaders in this project, not us. We're simply guiding and supporting their efforts, but we're not the leaders in this space. So I think there's a lot of maybe spices we could say, and considering that I'm Latina, to your mole, if you make real mole, there are a lot of spices that go into that mole sauce, right? So maybe it's just the different spices that go into the mole that make and have made this program successful.
Well, you got the perfect recipe. Thank you so much for all the work you do in the community, and for what you do for the youth as well.
Thank you, Michael.
So this is the at least the second time that I've heard the presentation, and I am curious, is this a program that is unique to Sonoma County, or?
Yes.
So it needs to be copied everywhere.
I know, we're working on that. And I have to say, Kathy, from the last time that we were here, I think you invited us to present to you, maybe last year, I think it was. And at that point in time, I didn't have all 4 tracks and all 3 tiers. So the program is constantly evolving. Originally, when we were funded, we only had 16 students and only 1 track, and that was mental health. We were very fortunate last year to receive funds to extend the program under the MHSA funds and include more promotores under our mental health track. So that's why we have more promotores under that mental health track. It's because it's funded by both the California Department of Public Health and now MHSA Sonoma County funds. So my goal is to continue growing the program. This was originally funded, as I shared, by the Office of Health Equity. And we just did our 5-year report because we just completed our 5-year grant. So we have a report, and it's funny because the state is pushing for us to publish our document, to publish our report, because Latino Service Providers Youth Promoter Program is actually the only youth-led program. We have the only youth promotor, meaning there's several promotor programs that exist, right? Promotor is a very popular, and right now very popular term, but we're the only organization that includes youth and leads their focuses on their leadership and development and introduction to the workforce, and particularly around these 4 tracks. And so we are in the process of publishing our document, of publishing our 5-year report, of publishing our data. I know we are going to Chicago in a few weeks to also introduce this model to Chicago. So I think eventually that'll be the plan, is now expanding the model and replicating in other spaces.
That's wonderful. I do have a quick question, since we are focusing on North County tonight. Are you present in the high schools there, Cloverdale, Healdsburg, Windsor?
Yes, absolutely. And in the past, we've had students. I know one of my promotores is from Cloverdale. The challenge, though, that we're trying to navigate is when we have students from Cloverdale and Healdsburg. Back then, I didn't have, so again, the data that you saw was from the first few cohorts. It didn't include my largest 2 cohorts, which is 5 and 6, that now include Cloverdale and Healdsburg. So when we first launched the program, we didn't include a stipend for transportation for our youth. And so after implementing the program, after the 2nd year, I realized I needed to start building a budget that includes transportation support. Because in order for our students to attend our monthly meetings or to be active participants, I need to provide support with transportation. So the exit interviews have been successful in providing me maybe the spices, right? The secret ingredients and how I can continue to improve our program in order for our students to continue to be successful.
And has COVID and having to do presentations in Zoom helped with that transportation issue a little bit?
Yes, but you know, as we've all experienced, there's also been the Zoom fatigue. So then we had to get really creative. I mean, my team was amazing at making virtual spaces engaging and interactive. I mean, we would do bingo and we would do spin the wheel. And so we definitely got creative in having our meetings virtually, but that is what allowed us to kind of branch out and see, could we have promotones from Marin and Solano? And I think for the virtual space, yes, it works. We're now implementing a hybrid model for cohort 6. So we'll continue to play with the idea and the opportunity, like, can we slowly branch out and reach out, creating more opportunities for more students to join us from other counties. And so now I'm using transportation money for field trips instead, is how I'm now spending out that money, but definitely continuing to develop that fund to continue supporting our students to be able to participate.
Perfect. Any other questions? I can't see everybody, so if you see a hand, let me know.
I can kind of wrap it up, Kathy, if
Okay.
no one is, okay. Lupe and Sarah, thank you so much. It's an exciting program that you're describing. I particularly favor the pieces about stamping out stigma. I think that's very key, and certainly if youth are promoting that in the community, that can only help the larger process around mental health. So thanks so much for your presentation tonight.
Thank you so much. And again, thank you for the invitations to share with you all about our Youth Promoter Program. And yes, if you can, please join us on May 13th, you said, Sarah, 5 to 7 p.m. at the Santa Rosa Junior College for Stomp the Stigma. It is an event to practice self-care and promote mental health awareness. So all are welcome. Thank you.
Thanks so much. Our next presentation, I would like to invite Becky Ennis to participate. She's the Executive Director of SOS Community Counseling. Becky?
Thanks, Bob. Good evening, everyone. It's so nice to see so many familiar faces and colleagues. I do not have a screen to share with you. I actually really wanted Luigi Valencia to be our presenter this evening. And for those of you that know Luigi, he is also, as well as a licensed mental health practitioner, he is a police officer, and his time is very limited. So here I am. You would have gotten a much better presentation from him. So if you could just hold and bear with me for one moment while I readjust my tabs so I can at least give you some good notes and speaking points. So I'm a big believer in connection. I think every connection counts, and just want to maybe draw some connections about folks in the mental health world and how we are all working together. So SOS Community Counseling, as Kim mentioned, we do have some of that mental health talent pipeline students and former students. Luigi is one, and which is wonderful, and want to highlight that Luigi actually sits on the board for LSP And Lupe's organization is now providing services back to the promotores in this regard. And so we've got that nice circle going there, that upstream investment of being a mental health talent pipeline recipient to being licensed and now giving back to those in the community that he also is a member of. I think it's just really kind of a great connection and like a, what do you call it? Not an epiphany, but like synchronous something, synergy. That's the word I was thinking of. So anyway, I wanted to just share with you some of the work that SOS has been doing in Northern Sonoma County for many years prior to my arrival with SOS. I've been the executive director just a little over 2 years now, started right before the pandemic. So mental health has been quite the topic of discussion during that time, as you would imagine. And we have a couple of avenues in which we're serving folks for counseling, mental health therapy. We do operate all of our programs in Cloverdale, Healdsburg, and Windsor. We have some in Katati Rohnert Park and just now moving into Petaluma City Schools as well and supporting their students and staff. But to focus on Northern Sonoma County, in Cloverdale, we have opened a clinic model at the senior center. So we are specifically targeting seniors within the Cloverdale region and hoping to support them with their mental health needs through counseling. We have 2 clinicians that are serving the senior center in the community there. One is bilingual, the other is not, and it's a very complementary relationship that both Catalina and Christy have. Christy being of the demographic herself, I think has some real great relatability to her clients. And then Catalina also with the Spanish speaking, able to bring in folks from the community that we wouldn't necessarily be able to serve otherwise. We also are on both the middle school and high school campus. We place clinicians there to work within what we call our team success model. And for those of you that have been around for a while, you might recall the project success model with the county and others. SOS was a member of that collaborative. And when Project Success, I believe, kind of dissolved for one reason or another, again, before my time, we took the program on the prevention, education, and intervention component and stuck on campus with that. And so we have been serving to date. Let me just give you some quick numbers. So as you could imagine, before COVID in Cloverdale, we had seen approximately 86 students for one-to-one counseling during that time. So that, basically equates out to 3 times the amount in terms of sessions. So we see those kiddos for anywhere between 8 to 10 sessions for anything around anxiety, depression, any kinds of suicidality. We also get in there as well and refer out to the appropriate people as needed. But we're also engaging with school staff, doing some teacher and personnel training. We had the opportunity to sit in on both of Cloverdale's professional development days and work with their teaching staff around self-care, mindfulness, and all of those wonderful techniques that our teachers are so desperately needing resources in that regard. We do classroom presentations. Prior to COVID, we did well over 2,000 classroom presentations in all 4 school districts that we serve. And in the 3 in Northern Sonoma County, that's about 1,600 or so, a little over half of all of our classroom presentations. And again, these are on things that the community and the school sites have said to us that are an issue for that particular school. So I've heard both from Lupe and Kim about the need to listen to the community and hear what is that's important to them. And so consequently, we do the same in working with our school sites to make sure that we're bringing forward mental health topics that are important to their students and really recognizing that students teach students and students educate students. And so if we can kind of grab a couple of them and teach them some tools, they're going to pass them on to their friends or refer their friends back to us. So it's a lot of good word of mouth happening on school campuses. Our third program in Cloverdale is actually the one that I kind of wanted to focus on this evening and just share with you some highlights, since it is our newest venture and opportunity. For a few years now, we have been operating a juvenile diversion program. And as I mentioned before, Luigi wears the hat of police officer and also licensed clinician. But we're fortunate enough to have two Luigis, if you will. Both Christina and Luigi are police officers and licensed clinicians. It's a very unique set of hats to wear, but so relevant today with our times. Christina supports our Windsor School District and Windsor Community Juvenile Diversion Program. Luigi's working with Healdsburg and Cloverdale. And so in this particular program, we are pulling kiddos a little more higher risk, a little more at risk, those that are dabbling into things that are considered illegal, and trying to avoid the juvenile justice system. And so we are providing their 10 to 12 weeks, depending on the misdemeanor. So for example, if law enforcement writes a citation, we will take these kiddos misdemeanor only. And of course, if it's a first-time offense, we don't have any reoffenders, or for anyone who's had any reoffense, we cannot take them back to the program. So it is a first-time offense program. We also take students that the district, say at high school or middle school level, are having issues in terms of maybe suspension or possible expulsion. So they try to utilize our program there to be able to keep them in the seat, keep them on campus, deal with some of those issues that are contributing to either maybe classroom attendance, other kinds of behaviors like smoking, vaping, fighting, all of those things that continue to escalate and to turn into other things that could be, involving the law. So we work in kind of two ways that way. We started the Cloverdale program, again, with some help from some of our funders, Healthcare Foundation and others during COVID. So that one was a little bit tricky, but I can tell you that to date, when we started last year in 2021, we've served 47 youth thus far, and we're in the process of just kind of finalizing our fiscal year. So we'll be able to get some final numbers out to the board or others if you're so inquisitive. But 47 youth between the ages of 10 and 18 in Cloverdale. So far, we've had a 99% success rate. We've only had 1% reoffend. So that one particular youth, when there is a reoffense, obviously the consequences there become a little bit more involved with things like house arrest or curfew, or even potentially juvenile hall. So we are happy to say that of that 47, 99% of them have not reoffended. If we come on down 101, same program, we've been operating in Healdsburg as well since 2018. And since 2018, we've served 171 youth. Again, we like to say we've kept 171 kids out of the juvenile justice system. Again, our youth in Healdsburg have been between the ages of 10 and 18. And we have a 97% success rate with a reoffender rate there of just a little bit larger. And in Windsor, our longest standing program, we've been operating juvenile diversion since 2017, so going on about 5 years now. 196 youth have been out of the juvenile justice system. Here we've served ages 9, believe it or not, to 18 with a 96% success rate. So again, we look at our recidivism, who has reoffended. Typically, all of our reoffenses are for the exact same act that they committed when they came to our program in the first place. When they enter our program, they're connected with someone like Luigi or Christina. They sit down with not only the counselor, but with the family for a short portion of that time. They're going to sit with mom or dad, aunt or uncle, guardian, whoever is in the home, and really come to understand what the program means and what they need to do. Again, depending upon that misdemeanor or the reason for referral, we're going to work through some restitution. We're going to maybe write a letter to somebody. Maybe we'll do some community service. That's any and all of those things, right? So we're not just talking about therapy, but we're talking about all of the other things that come around with that, and try to really support that kiddo in the home environment, get some parents, education referred out to places like CPI, so on and so forth. So there's just a lot of opportunity here to come around and bring our arms around the family and the youth. Just wanted to share for you just a sense of the type of client that we're seeing. And this is a female youth from Cloverdale. She's currently this year, she's 15. She came to us because she was heavily using controlled substances on campus for a few years prior to coming to our program. The student was found to actually have overdosed on campus and was rushed to the emergency room in Santa Rosa. Aftermath of that, as you could imagine, was that she was subsequently suspended from school. And instead of going to juvenile hall, she was referred to us. So she was able to tackle some of her childhood trauma through our program that had been causing her to disassociate. And that was really what was leading to the controlled substance use, right? A lot of our kiddos are doing some sort of drug to help cope with some mental health issues. And she was truly having some disassociation. She really wasn't aware of all of this until it was kind of brought to light through therapy. And so it allowed her, again, to meet one-on-one weekly over the next 2 to 3 months, getting to the point where ultimately, now being aware of all of this, she kind of had to make these decisions as to whether or not she was going to choose to use. So overall, the story is basically a prime example of what empowerment can do for folks. Self-empowerment through therapy. This is what it looks like. She was held accountable for her actions, but also been given that ability to kind of go back to the drawing board, to examine her behaviors in a way that she wasn't able to previously. So we really offer up some structure here and support the things that need her attention, also the community's attention, the school's attention. So if you want to fast forward, so that was at the beginning of the school year. So now here we are, we're almost finishing up the school year. She is now on honor roll. She is gearing up towards a 4-year university and hopes to become a veterinarian, complete 180 from where she was at the beginning of the school year to where she is now. So this is just an opportunity to reset. It's a juvenile diversion program that is really going to get to the crux of the behaviors and why students are doing what they're doing. So I really did want to share that with you. I wanted to thank those that are on the call that have provided the support to be able to expand to Cloverdale. Cloverdale is obviously a very remote community, at least in terms of Sonoma County and support around mental health or any of those other social services. So I'm going to leave it there because we have had quite a few presentations and I feel like I'm going to repeat a lot of wonderful things that both Lupe and Kim have already said in terms of a philosophical general sense, but happy to finish up the school year, and we hope to have our annual report out by the end of the summer so we can share more about what we've been doing in Northern Sonoma County.
Thank you, Becky. Sherry has her hand up.
Hi, Sherry.
Okay, can you hear me now?
Yeah.
It's been a long time since I've been at one of these meetings to know how to navigate it all. I just really want to thank you. As somebody that's been on this board for a long time, I can go back to saying, how do we reach the Latinx community? How do we do that? And I'm just so happy to hear everything I've been hearing this evening. It's does my heart good. And especially thinking, I didn't write down the numbers, but I'm thinking like maybe 250, almost 300 students that are youth that you've been able to keep out of the juvenile justice system. It's amazing. It's just, these are really difficult days that we're in, and it's confusing for adults, let alone our kids. And it's just incredible. And thank you doesn't seem like enough to say, but thank you.
Oh, thank you, Sherry. I appreciate that. Yeah, it's really amazing. I wake up in the morning and I'm amazed at what our staff are doing in our organization. And I'm just super blessed to be at the helm and have them guide the way and do the work.
It's beautiful. It really is. And I really appreciate the presentation before too. I learned when I was working with developmentally delayed and severely emotionally disturbed were the terms that were used in special day class when back in the 90s when I was working in those programs. And I learned that if I wanted to reach the students, I had to let them know that I respected them if I expected their respect. And that's how it worked. And that's how it worked for me. But the issues and the challenges were great then, but nothing like now, I don't think. And I just really, like I said, thank you doesn't seem like enough.
Well, thank you. And to your point about, the respect that you were just speaking to, it reminds me too that we, sadly, a lot of our students, almost all of our students in this program are brown and Black kiddos.
Yeah.
And to have a therapist sit across from them that looks like them is very encouraging and is very important to continue to build that trust. So I definitely acknowledge that.
Sorry to interrupt, but I mean, it does show those students that that they can be that too, I mean, that just to have their community work within them and it's with them is incredible. Yeah.
Thank you, Sherry.
Yeah. Thank you.
Lupe?
Yes. Hi, Becky. So nice to see you virtually.
I know. Nice to see you.
I'm just, it's really a comment and just to say that, I'm very appreciative of our relationship with SOS. For us at Latino service providers, it's very important that if we're teaching our youth about mental health, that we also give them the opportunity to experience what that looks like, what that feels like, right? And I think our relationship with SOS has allowed us to do that. So fortunate for the MHS funds that have allowed us to have this partnership. But again, I think this is another opportunity for us to model not just the greater impact that we can have collectively, right? Two agencies working alongside to create change, and then having Luigi leading our youth in group therapy has been amazing. I mean, the feedback that we received from our youth has been very positive. And so I'm very, very appreciative of that opportunity for our youth and creating spaces really and opportunities for our youth to take advantage of group therapy and individualized therapy with SOS. So thank you for all that you do.
Oh, thank you, Lupe. Thank you for being willing to collaborate and share resources. It's really been a wonderful experience.
Betsy?
Yeah, can you all hear me?
Yes.
Okay, sorry, I'm in Sonoma. It has really low connectivity. Becky, first of all, I miss you. So nice to see you here. Second of all, I will always remember how inquisitive you were in a conversation we had about working with our Latinx and BIPOC students. And it's so appreciate the collaboration and the partnership you established. And I think the work can be shown and seen. And I hope that others can learn from this because it's so powerful what you're doing. It's so great. And I also wonder if there is any feedback that you are all providing to those that are working with our youth in the juvenile system, and if they're able to work alongside your staff to train and to better serve our students. I don't know if that's something that's happening. It probably is. But also, what is your connection with Hannah Boys Center? I think they're trying to do something new, and I wonder if a partnership with you would benefit what they're doing and learning, or just in partnership. I think that would be maybe something to work on. I don't know.
Yeah.
Wanted to ask those.
Yeah, thank you, Betsy. To your point about Hannah, I'm not aware at this point, at least the Boys Center. I'm certainly with Hannah Institute, been continuing to stay in contact and working with Aaron and the team and you over there as well. But yeah, I'd love to talk about that. And then to your first point, in terms of having conversations with other entities that we're working with law enforcement, that is an interesting nut to crack. I think it is sometimes easier said than done to, have a conversation, but then see things actually work out in reality and in real time. However, I do have to say that in my conversations with all of the 3 police chiefs that we work with, they all are incredibly supportive. Almost all of them, 2 of the 3 were SROs prior to becoming chief. Just a point of note, Chief Burke, whom I'm sure most of you know, passed away recently, retired chief of Healdsburg. He was the impetus for really getting this program off the ground, and his support in the way that it worked. And so I think it's a little bit of trickle down at this point. I would love to see some more conversations and different training and collaborative opportunities with actually folks that are out on the beat, so street officers and so on and so forth. So it's something to consider, but I know that we have strong support at the heads of their departments. And so if we were to bring that forward in a more concrete way, we would probably be received, very well.
That's great to know. Thank you so much, Becky.
Oh, you're welcome.
Thank you very much for your presentation. Any other questions for Becky?
Thanks, Kathy. Great to see you.
It's good to see you too.
Okay,
Bob, do you have-
Becky, thank you so much. Exciting things that you're sharing about working with youth. And I hope you're able to continue that. And also the work that you've been doing in schools, and perhaps that will be allowed to expand as well. Anyway, thank you so much for being with us. I'd like to introduce the next presenter, Mary Frances Walsh, who's the Executive Director of NAMI Sonoma County. I see what she might offer us this evening. Mary Frances?
I had seen Mary Frances. Oh, she's here.
I'm so sorry. I'm here, but I'm trying to share my screen. That's what I was saying. Sorry, I apologize.
Let me make you a co-host. There you go. You should be able to.
Okay, here we go. Not too many, because it's been a long evening. But I am so impressed with what I've heard this evening. So again, this is me. I want to, when Bob asked me to speak, he asked me for 2 things. One, to just describe a little bit about what we do in the North County, and then also if I had any information to share about the experience of what mental health needs look like in the North County. At least that's how I interpreted it. So I have, it's just over a minute, a little introduction to NAMI, which is a nationwide organization. We are the Sonoma County affiliate.
Each year, 1 in 5 U.S. adults experience mental illness, and 17% of youth ages 6 to 17 experience a mental health disorder.
I joined NAMI because I have 2 sons that live with a mental illness, and I didn't want any other families to feel alone like I did.
At NAMI, the first thing we want anyone to know is you are not alone in your mental health journey.
I just really want to talk about so people know that you don't have to go through it alone.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, dedicated to building better lives for the millions of Americans affected by mental illness. We started as 2 moms, gathered around a kitchen table in 1979. And today, we are an alliance of more than 600 local affiliates and 48 state organizations who work in your community to raise awareness, build advocacy, and provide support and education. NAMI envisions a world where all people affected by mental illness live healthy, fulfilling lives supported by a community that cares. Every year we are expanding, no matter matter race, religion, age, or sexual identity. We are people with lived experience, families and loved ones, survivors and advocates. And together, we will fight the stigma surrounding mental health and create a better world for the sake of all of us. We have resources for you and can't wait to become an extension of your family. We're here for a healthier world. We're here for better mental health. We are here for each other. Join us.
Okay, thank you. Oh, geez. Okay, whoops, go back one slide. We are the Sonoma County chapter. We too were started by families in Santa Rosa who found one another in 1981. NAMI was founded in 1979, so it's been around for 43 years at the national level. But there were a group of families that began meeting in Santa Rosa because they were struggling with not knowing where to turn to support a loved one with a serious mental illness. And they started it as the Sonoma County Alliance for the Mentally Ill. And they began having monthly meetings just to share information and resources and try to educate themselves about these illnesses because there was so little public information shared about these illnesses and about where to go for help. So NAMI Sonoma County was affiliated officially with NAMI in 1984. Everything that we do is free. We do have a website. We can be reached by this info@namisoco.org, and we operate a warm line. So it's called warm because it's not 24/7 and it's not 7 days a week. It's basically business hours, but we get about 60 calls a month from new callers, people who are struggling, mostly from family members, figuring out where to get help, where to turn, how to help somebody who is refusing care, somebody who's been in crisis, somebody who has been incarcerated, for example, with a mental health condition. And it doesn't want to go to the next slide, sorry. Okay, so just in sum, what we do is we have education programs, some for family members of adults. NAMI Basics is an education program for family members who have a child or an adolescent experiencing mental health challenges. We go out into the schools with a presentation called Ending the Silence, which is trying to make conversations around mental health and help seeking for mental health normal and part of something that everybody grows up on experiencing as part of our overall health. Two of us are also on staff are trained as QPR gatekeeper trainers. So that's a suicide prevention training. We do awareness. I in particular will speak wherever I can about what we do and about the needs in our community. We do this for workplaces, for community groups. We sometimes host community forums. The last one we hosted was in November to focus on the changing model of mobile crisis response here in Sonoma County. We have monthly speakers. We have a newsletter. But perhaps one of our most important points of connection are our support groups. So we have them for family members. We have an existing group for family members who are Spanish speaking, and we are about to train 4 bilingual staff members from Humanidad Therapy and Education Services to be able to conduct NAMI, these groups, Grupo de Apoyo para Familiares, in Spanish, and we will work with them because I see Humanidad as having the relationships with the Latinx community that NAMI Sonoma County lacks, and we have really a quality program to share. So we're going to be working together, and it will look like it needs to look for those families. It's certainly adaptable in that sense. We have connection support groups, and those are for people who are living with a mental health challenge, who are in recovery. So we're really providing support for people, a safe place to talk about the challenges they experience and to experience a sense of caring community. And finally, we do offer wellness and stress relief groups open to anybody. And those came out of after 3 years of running wildfire survivor groups. When the need sort of dropped off, we transitioned to just teaching and practicing techniques that help people better manage their stress. And then I talked about our warm line. So that's open to anybody. And our warm line, we get direct referrals from the county's mobile support teams, Santa Rosa's in response team, and the safe teams in Petaluma, Guatari, and Rohnert Park. So those are family members who have experienced a mental health crisis among somebody in the family and have agreed they would like some kind of additional help or support for family members. I won't go over this, but this is just a brief example of our monthly calendar. So on the left are education programs and speakers, and then we have a schedule of our support groups. Since March of 2020, everything that we are doing is still virtual, and we have not made the decision yet to go back in person. What that has done is it's really expanded our reach, because we have people joining us from Lake County, Napa County, Mendocino, and even Marin County, because some of those counties do not have a NAMI, and people know about NAMI through other resources. And the NAMIs in Mendocino and Marin are very small. So for the time being, we have opened our programs to anyone who's in need of help. And I see, I forgot to load the updated slide here, but it's not April 27th, it's on April 28th. An example of our monthly speaker is that we're doing one on understanding LPS conservatorship. We have Sid McCauley from Sonoma County Behavioral Health, and we have Jennifer Hainstock from the Office of the Public Guardian. And this is driven by the fact that we get many calls from families who say, how do we obtain conservatorship? And there's a very high bar. We want people to understand that and why that high bar exists. But how it works, just understanding the law, understanding how and it doesn't always work so well. But we want to give people an opportunity to hear and to ask questions. So we are even smaller than most of the other agencies, but this is our staff. But what I want to say is that we carry out our programs because we have a number of very dedicated volunteers who are all family members who have been there and who are now in a place where they want to give back. We have educators, we have lawyers, we have a post office worker, we have a physician, an ENT physician. I mean, these are people from all across the board who have gone through training to teach our programs or facilitate a group because they care, because they understand the need that family members experience in particular for support. How were you funded? Through Mental Health Services Act funding. We get some money from Community Foundation Sonoma County, from Kaiser Permanente, and from Providence. And we do get individual donations and contributions. So in terms of North County, and I did this not only for this meeting, but I'm always interested in knowing where the needs lie and what it's like. So this is who I reached out to, and I did not reach everybody, but I will tell you what I see, what I did hear. So in the North County, furthest north, Cloverdale, there's Alexander Valley Healthcare. That is a federally qualified health center. So it's a primary care clinic offering physical health services, but they do have a behavioral health services department. And these are the things that they can help people with at any age. And they are really designed to help people with mild to moderate symptoms. But I'm going to share in a minute what they're experiencing, which is many more people with more severe symptoms and a lack of resources to be able to successfully provide them with services. The Cloverdale Police Department, I bring this up because on our warm line, I've spoken with many, many families who experience a mental health crisis. The mobile support team of the county can rarely make it up as far north as Cloverdale or even Windsor. They just simply don't have the staff to do that. So while we have some phenomenal new programs taking place in the county, the In Response team in Santa Rosa, as an example, and the SAFE team in Petaluma, but those services are geographically limited, and we still have people in many parts of the county who also experience crises and have a tough time getting the help they need. In Cloverdale, the police will respond to a 911 call, and I think they do their best. They often will take them to Healdsburg Hospital Emergency Department. I did not get to speak with somebody at Alliance Medical Center, but you can see that's another federally qualified health care center that has 3 primary care clinics in Windsor and Healdsburg. They similarly offer a realm of behavioral health services. They treat all ages, but I think similarly, they're designed to help people with mild to moderate symptoms. I did speak with this case manager. She's a social worker at Healdsburg Hospital. And she really is it in terms of mental health treatment options. I also spoke with Jeff McGee. I've been in touch with him before. He's a social worker that is on staff with the Healdsburg Police Department in a program called Community Oriented and Equity Policing Team. And that too was a brainchild of Kevin Burke, the former police chief from Healdsburg. And then on the margins, I think you've heard about
chicken too. Yeah,
earlier,
back to chicken, but we can go.
Earlier this evening, and that organization is providing free bilingual, bicultural, no-cost mental health services to people in Cloverdale and Geyserville, 1 day a week by telehealth, and 1 day a week at La Familia Sana, which is it's a wellness program serving the Latinx community in Healdsburg. So just issues that I heard from. I had the longest talk with Amy Braun. She oversees mental behavioral health services for Alexandria Valley Health Center. Again, she just reiterated the point that they're equipped to serve mild to moderate mental illness. But in fact, they feel like they're seeing more than half of their population have needs that are more severe than just mild to moderate. She has been, I did this in a hurry, so excuse my typing, but she's been there for 2 years in her role. And she is constantly surprised by the numbers of young people who are coming to the clinic showing signs of serious mental illness. In other words, a psychotic episode, psychotic illness. The health center used to have regular visits, meaning that a Sonoma County behavioral health psychiatrist and social worker and even a support person from Buckaloo was able to go to the clinic and see people who had more severe symptoms than they were equipped to manage, but that ended with the pandemic, and those services have not yet returned. Because Cloverdale in particular is an inexpensive community. There are many people who are finding housing there with untreated serious mental illness. She says they're not healthy and they're not functioning well. That center has no staff pediatricians, which means there's also no support for families who have a child or an adolescent who are newly diagnosed with a mental health challenge. Even families who have a child diagnosed with attention deficit disorder, they're being offered support online, but there's no in-person support. She also mentioned, anyway, I'll go back to that, sorry. Healdsburg Hospital, the emergency department. She says basically what happens, and I don't think this is unique to just Healdsburg Hospital, but people who are in mental health crisis are placed in a room within the emergency department to de-escalate, to calm down, and then they're released for the most part. It's a revolving door because they're not being connected with treatment or they're refusing treatment. So they've taken a new tack. If somebody's really in serious need, they're sending them to Memorial Hospital rather than to Healdsburg Hospital. But I think we all know that there are problems with throughout our hospital system with patients being boarded because of the shortage of inpatient beds to send them to. I mean, there are system problems. She said that before the pandemic, there were many homeless people in the area that would come in periodically to the clinic to at least be seen, to have some kind of connection, and they don't see them these days. They're not coming back in. They don't have any capacity for not warp around, but wraparound services. And even though there is some federal funding available, this center just simply doesn't have the administrative capacity to be applying for those kinds of grant funds. She said that they love the program that are offered by the Child Parent Institute, but the families either don't want to or cannot travel. You know, it's expensive, and these are many low-income families, working families. Driving into one of those programs is difficult. And I don't know, CPI may well offer some of their programs virtually, but connectivity may be a problem, or even just having the time to attend those programs. She's seeing a young population with increased mental health needs. The clinic at the Alexander Valley Health Center does work extensively with the schools, and they do see students that the schools may not be able to help because their needs are too high. Many of these young people live in homes with a single parent, where the parent has a mental illness or a substance use disorder. She talked about a 2-year-long struggle they had to try to place a teen with serious mental illness. We all read about him in the papers when he was driving a cab and he stabbed a passenger outside Windsor Regional Park. He was ill, and they kept seeing him, and they couldn't find a placement for him. They see patients who are suicidal, and they will, if somebody comes in with suicidal ideation, they will see them the next day, but those patients are really not being connected with follow-up treatment just because lack of capacity. There are no private clinicians, no private psychiatrist in particular in Cloverdale. She says, we're it for mental health services at this center. She said the greatest thing she would like the county to hear is that they need mobile crisis support. They want a team, ideally, just like the in-response team, for example, somebody that could get to know the patients with severe and persistent mental illness and get them connected to treatment, which I know is not easy, no matter where you are in the county. And I think they feel isolated, so they want to be considered as the county plans for services. I spoke with a case manager at Hillsburg Hospital. She said they see between 50 and 90 patients a month who need some kind of mental health services. She said it was infuriating that the crisis stabilization unit had reduced its beds. So all that tells me is that a lack of communication and isolation, because there's really not a deep level of understanding of why the crisis stabilization unit has had to limit its beds, due to many reasons.
Mary Frances?
Yeah.
I'm going to interrupt you just briefly because there's only 10 minutes left.
Okay, this is mine. So go ahead. And you have more to do?
Well, I want County Behavioral Health is going to present probably a response to what you're saying. So
okay.
Given that,
I'm almost done. I have
perfect.
One more very short slide. Anyway, they have, in the area, she is very frustrated with their lack of psychiatrists. Many of them they cherry pick patients. This is what she said. She said they don't want to see patients with serious mental illness. They only want to see patients who have depression and anxiety. They don't want to write 5150s. They don't want to get involved. And of course, throughout the county and in North County, the lack of supportive housing and crisis residential services. She did have is a problem She had very positive things to say about Hillsburg Police Department and their interactions, and also the Sonoma County Behavioral Health Transitional Age Youth Program. And then finally, I already spoke about Jeff McGee, who is a social worker on staff with the Hillsburg Police Department. And he too said that there are so many people that he tries to help who need medications in particular and find them very hard to get filled. And he just said there's no psychiatrist to refer them to. So that's my snapshot of the problems. So thank you for listening. Thank you for the invitation, Bob.
So, Mary Frances, I mean, that was so important and such a concise, you really hit all of the points that, you know, your research was so thorough. And I think that, that we may need to have you talk again at some point.
Sure.
About this, but I want to give the Wendy a chance to speak. And poor Maddie, he didn't get to speak last time either. So I'm going to go ahead and let Wendy speak and not even have people question you at this point. Okay?
Could I do something 20 seconds? Mary Frances, that was great. I like the programs you're doing. That last part of the needs, you did a fantastic job. Would you be able to share those slides with us?
Sure, of course. Yeah.
I agree. I mean, that was invaluable. And I think that people need to look at it very thoroughly on many levels. So, Wendy.
Hi, Kathy.
Are you still there?
I'm still here, hanging on.
Oh my gosh.
All
Again.
right, I'm gonna try to condense it into 5 minutes. Will that work? Okay. No problem. So first update, there is a director selected. That person is going to start in May. This is a big deal. I'm expecting some kind of release soon, naming the person and giving a little background. But it's someone who has experience in crisis services, in running sections, in other counties, is familiar with county programs, has experience with children's services, but as actually from Sonoma County. So understands our local flavor. As I was explained, that it's important to have the right spices in the mole. So we're definitely excited about this. This individual is Spanish speaking also. So this is pretty exciting for us. We have a new director coming on board. In our substance use disorder services section, a new program manager has started, and that person is overseeing TASK, our court programs, drug-free babies, adolescent treatment program, the AOD testing, and will be the contract manager for the treatment providing programs in the community. So this is going to be some well-needed assistance to Melissa Struzzo, who's the section manager over substance use disorder services. So that's very exciting. Sage Commons is a housing development through No Place Like Home funding. It opened and everyone moved in and it is full, and that is awesome. And we are so excited about that. They've been working very hard to build community on site. They have case management and assistance and support on site, and they're working very closely with us and other partners in order to make that venture successful. And so we're very excited about this. Okay, relevant to the topic today, the Board of Supervisors approved mobile support teams expansion into North County. And yes, you may celebrate with us on this. So recruitment has begun to staff those positions so that there will be a dedicated North County MST response team. So that is what Sid is working on right now. If she were here, she would be doing cartwheels. In addition, with the CalAIM initiative changes that are starting now and going to be going for the next couple of years, one of them is particularly around the access process. So the screening team and field access team has been meeting with our various community FQHC partners who send us referrals. So we met with Amy Brom from Valley, and we met with Alliance just this past week to look at how can we streamline our processes and make successful referrals between our two systems and maximize the chance of a good continuity of care. As part of this, we are also re-envisioning our former whole person care program. It's transitioning to what's called an enhanced care management model. That's a requirement from the state that we're doing this process. But Elizabeth Storm, who manages our satellite clinics in Cloverdale, Guerneville, Petaluma, and Sonoma, is making space so that the new ECM team will be able to do homeless outreach and support directly from the regional offices as well as from the Santa Rosa offices. And so that's pretty exciting news for our outlying clinics. In addition to that, we are looking at applying for specific grant funding, but also utilizing our new whole person care team to do in-reach services in the jail. One of the most exciting things about, well, there's so many exciting things about Cali, but one of them that's particularly helpful in this area is that we historically have not been allowed to get somebody's Medi-Cal turned back on while they're in custody. And it creates a huge problem at discharge, at release, because they're released with a prescription, here, go fill your meds, but they have no way of doing it. And so the state has seen this as a problem. Every county has this problem. And part of the CalAIM changes that are coming is that we will be allowed to do direct in-reach claim to Medi-Cal for that and get people's benefits turned back on in advance of their release date in order to facilitate a successful navigation back into the community. We're very excited about this. Sid is working with multiple partners on what this could look like so that we can build some system navigation into this process. So let's see. Chris Marlowe, who is our lead on all things CalAIM, I know she came and did a brief overview for the Mental Health Board, but she wanted me to follow up and let you know that if you would like a more in-depth review as we're going forward, she's willing to come back and do that for you. Let's see. Oh, last thing. Let's see. How am I doing? Oh, I'm right on time. Okay. Cal Mesa is, to get the right website for this. Cal Mesa is doing a job task analysis survey specific to peer certification. So they're asking for stakeholder feedback, and they specifically want that from people with lived experience. And they've got a survey up on their website right now to help examine kind of the most critical elements of the certification program based on what it is like to work as a peer and what the jobs require. And they want to hear from people who are actually doing that to inform this process. So Sid sent out to some of our CBO partners who employ peers requesting that you participate, but I want to make sure that the Mental Health Board knows that this is now posted on the Cal Mesa website under the peer certification section, and there's a direct link to the survey so that people can participate in this stakeholder process to inform how that could look. And that is my 5-minute condensed version. And Kathy, you're on mute.
Okay, Wendy, that was amazing. I want to encourage you. I think Mary Frances is going to send that your slides, the last ones, to everybody, and they were so full of information. I encourage you to, point out to your team that they have some real meat there. Maddie, are you around? I'm not hearing him. He's having.
I don't think so. I think they were here earlier.
Yeah,
but they might have had to leave.
So I'm going to figure out how to put Maddie. He's missed presenting twice now, so I'm going to figure out how to put him in it toward the beginning of right before Melissa's presentation next month. But I do have one thing that I want to talk about, and that is this year is coming to an end. It's time for me to step down. This will be the end of my 3rd year as chair, and I legally can't do a 4th year. So, hey, I'm tired. I'm going to tell you that the nominations for The nomination for chair is Peterson Pierre. And the nomination for vice chair is Betsy Chavez, and we will vote on that next month. So we ran out of time because it was such a full program. And I mean, I'm amazed at everything that's happening. I want to say that we were going to acknowledge the Sonoma County Behavioral Health staff, and we were going to go on a little bit about how wonderful they are. And we're going to do that next time too. So since we are totally out of time and I'm over, which we haven't done too much lately, but enough. So I will entertain, unless there's something really super important, I'm going to entertain a motion to adjourn. So that means
Betsy Chavez so moved.
Okay, Betsy moved. I need a second.
I second it.
Bob Cobb is second.
I second it. Yeah, yeah.
Okay, the meeting is adjourned, and we will see you next month for the Mental Health Services Act annual report.
Thanks to all our presenters tonight.
Yes,
Thank you, everyone.
all.
Great program. Thank you all.
Thank you, everyone. Have a good night.